What happens when you combine statins and blood thinners? Imagine you're taking medication to lower your cholesterol and another to prevent blood clots. What happens when these two are used together? This is a common question for many managing heart health. Combining statins and blood thinners can be helpful but also tricky. It's important to understand the potential effects and risks involved. Statins are drugs that help lower bad cholesterol levels in your blood. They reduce the risk of heart attacks and strokes. Blood thinners, also called anticoagulants, like warfarin, prevent blood clots from forming or growing. When you take both, your body processes these medicines in ways that can cause problems if not carefully managed. One major concern is muscle damage. When statins and blood thinners are combined, the risk of muscle injury increases. This can sometimes lead to a condition called rhabdomyolysis, where muscle tissue breaks down rapidly. This releases substances that can harm your kidneys. Symptoms include muscle pain, weakness, and dark urine. If untreated, it can lead to serious kidney problems. Both drugs are processed in your liver by the same enzymes, which can cause higher levels of statins in your blood, increasing this risk. Another issue is bleeding. Blood thinners are designed to thin your blood to prevent clots. Some statins can make blood thinner effects stronger, raising the chance of bleeding. This can be dangerous, especially if bleeding becomes severe. Doctors monitor blood clotting levels, like the International Normalized Ratio, or INR, to keep things balanced. They may adjust doses to prevent excessive bleeding. Drug metabolism also plays a role. Both statins and blood thinners are broken down in your liver by enzymes called cytochrome P450. If these pathways are affected, it can change how fast your body clears these medicines. For example, atorvastatin and warfarin both use these enzymes, which can lead to increased drug levels and side effects. For patients with high cholesterol who also need blood thinners, it's essential to tell your healthcare provider about all your medications. Regular blood tests and monitoring for muscle symptoms are key. Sometimes, doctors might recommend alternative statins like pravastatin or rosuvastatin, which are less likely to interact. Also, avoiding certain foods and supplements can help. For instance, grapefruit juice can increase statin levels, and foods rich in vitamin K, like spinach, can affect warfarin's effectiveness. In summary, combining statins and blood thinners can be effective for protecting your heart and preventing clots. But it requires careful supervision. Monitoring for muscle pain and bleeding, adjusting doses, and choosing the right medications are all part of safe therapy. Always follow your doctor's advice and keep all your healthcare providers informed about your medications to stay safe while managing your health.